Let's discuss on vitamin C. Vitamin C or ascorbic acid is also a water-soluble vitamin which is abundantly present in various citrus fruits and berries, and it is also important for tissue repair and collagen synthesis. Vitamin C is structurally, it is a six-carbon sugar derivative. It is more like sugar, and humans in higher primates and guinea pigs and bats cannot synthesize ascorbic acid due to the lack of the enzyme gulonolactone oxidase, which is present in some lumar organism who can synthesize in vivo the vitamin C. Ascorbic acid, it in itself is an active form. It can strongly reduce because diol group is present. That's how it is strongly reducing in nature. So it gets oxidized to dehydroascorbic acid, which is also an active form and which can finally be converted into oxalic acid via formation of diketoalgolonic acid. So it is involved in various oxidation reduction reactions also because of its strong reducing nature. Then dietary sources of vitamin C are gooseberry, guava, lime, lemon, and various other citrus fruits, green leafy vegetables. Recommended daily allowance is nearly 75 milligrams per day. During pregnancy and lactation, it can increase up to 100 milligrams per day. It is the important biochemical functions of vitamin C. It is important for hydroxylation of proline and lysine because hydroxyproline and hydroxylysine are essential for formation of cross links in collagens, which give the tensile strength to fiber. And it is also involved in the tryptophan and tyrosine metabolism. It is important for hydroxylation of tryptophan to 5-hydroxytryptophan for the synthesis of serotonin. While in tyrosine metabolism, para-hydroxyphenyl pyruvate is being formed in the presence of ascorbic acid and which lead to formation of a homogenesic acid. Then iron metabolism, ascorbic acid important for absorption of iron. It converts the ferric iron to the ferrous state. Then hemoglobin metabolism, reconversion of methemoglobin to hemoglobin. And then it is also important for folic acid activation. It helps the enzyme folate reductase. Then it is also involved in steroid synthesis. Vitamin C helps in the synthesis of bile salts from cholesterol. The initial 7-hydroxylase step is stimulated by the vitamin C. It is also important for immune functions. Phagocytic cells they get activated because ascorbic acid stimulates the phagocytic action of leukocyte. Then antioxidant property. Aniline dye are known to induce the bladder cancer in the factory workers. So daily intake of vitamin C is recommended to them to reduce the risk of cancer. So this important reaction where the conversion of proline to hydroxyproline is happening in the presence of ascorbic acid, which requires the molecular presence of oxygen as well as alpha ketoglutarate to succinate. And this reaction is also being done for conversion of lysine to hydroxylysine. Then the deficiency manifestation of vitamin C is a very well-known disease that is known as scurvy, which is associated with bleeding and swollen gums, painful, and this leads to loosening of teeth, and pulp is separated from the dentine, and wound healing is very much delayed. If among the infants from 6 months to 1 year, if there is a deficiency of vitamin C, that will lead to infantile scurvy, and that is also known as Burlow's disease. That is also associated with bleeding gums and bleeding with painful, swollen, and spongy gums. Gingivitis and bleeding gums. This is the picture shows deficiency of vitamin C. Deficiency of this vitamin leads to hemorrhagic tendency because in deficiency of ascorbic acid, collagen is abnormal and the intercellular cement substance is brittle. So the capillaries are fragile, leading to tendency to bleed even under the minor pressures. leading to subcutaneous hemorrhage, which is manifested as petechiae in mild deficiency and as an ecchymosis or even the hematoma in severe conditions. Retinal hemorrhage and epistaxis is also being reported. Then bones, in deficiency, the bones are vigorously disordered. The osteoblasts are not able to form the osteoid. Then a scorbutic rosary leading to depression of sternum joints, effusion, and then pseudo paralysis happens. And Borlow's disease I already discussed, which is infantile scurvy. Vitamin C deficiency manifestation in nails also has been noticed, leading to the spoon-shaped concave nails with red spots in the nail bed and known as a splinter hemorrhage. Anemia is another manifestation of vitamin C deficiency. It leads to microcytic hypochromic anemia due to the deficiency of iron. Iron absorption is important for RBC's production. And in absence of vitamin C, there is a lack of iron, and it manifested in the form of poikilocytosis and anisocytosis, which is common in anemia due to the deficiency of vitamin C. You can see this is the picture of poikilocytosis, and this is anisocytosis, abnormal and different size of RBCs are there. Then therapeutic uses of vitamin C. Vitamin C is used as an adjuvant in infection. Beneficial effects of ascorbic acid is reported in the treatment of tuberculosis. When the plasma level is kept near saturation point, the clinical dose is 500 milligrams per day. And because of its power to heal wounds, vitamin C has been recommended for the treatment of ulcers, trauma, and burns. Here is a case study. I hope you will be able to crack this after having gone through my lecture. A 29-year-old male executed living alone present with the bleeding gums and petechial hemorrhages on the skin of lower limbs. He's also feeling weakness and there is a loss of appetite for last 1 month, and he is mainly dependent on frozen foods and junk food. He has history of frequent common cold and cough, and blood shows the hemoglobin 9.8. Blood smear shows the microcytic hypochromic RBCs, pyokilocytosis, and anisocytosis are also seen. So you can see the various important keywords relevant to the deficiency of vitamin C, like this microcytic hypochromic RBCs, then pyokilocytosis and isocytosis is there, petechial hemorrhages, bleeding gums. So all these indicate the vitamin C deficiency. So you please go through this question. What is the probable diagnosis? Explain the biochemical rationale and write down its treatment. Thank you.